Garlic water, despite its many health benefits, may not be safe for some people. This healing beverage, which has powerful antioxidant and anti-inflammatory properties, can cause health problems for those who suffer from certain health conditions. Let's take a look at 20 points why and for which health conditions you should avoid drinking garlic water. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Number 1. Gastritis in the acute stage is an inflammation of the gastric mucosa caused by factors such as the bacterium Helicobacter pylori, stress, alcohol, medications, and poor diet. During this period, the stomach is particularly vulnerable and sensitive to irritants. Garlic contains allicin and other sulfur-containing compounds that, although they have antibacterial and anti-inflammatory properties, can irritate the inflamed gastric mucosa. This can increase inflammation, pain, and discomfort as garlic stimulates the secretion of gastric juice. In gastritis, the inflamed gastric mucosa secretes more hydrochloric acid and enzymes, which can lead to tissue damage. Consuming garlic during this period can cause heartburn and worsen the condition by slowing down the healing process. Symptoms of gastritis include pain in the upper abdomen, heartburn, nausea, and vomiting. A 2015 study found that regular garlic consumption can worsen these symptoms and cause gastritis to worsen. Researchers observed gastritis patients who consumed garlic and found that most patients had worsened symptoms. Therefore, when gastritis is exacerbated, it is important to avoid foods that can aggravate the condition. Garlic water, despite its beneficial properties, can be too aggressive for the inflamed gastric mucosa. It is recommended to avoid garlic and other irritating foods until the mucous membrane has fully recovered. Instead, you should follow a gentle diet that includes gentle and soothing foods that are non-irritating and promote healing. Number 2. Gastroesophageal reflux disease, GERD, is a chronic condition in which gastric juice backs up into the esophagus, causing heartburn, sour taste in the mouth, chest pain, and difficulty swallowing. The esophageal mucosa is not protected from acid and stomach enzymes, leading to inflammation and tissue damage. Garlic contains allicin, which can stimulate the production of stomach acid. Increased acidity increases the likelihood of reflux by increasing pressure on the lower esophageal sphincter, making reflux more frequent and intense. Garlic also has a sharp flavor that can irritate the inflamed mucous membrane of the esophagus, increasing symptoms of heartburn and chest pain. Regular consumption of garlic in this condition can worsen inflammation and slow down the healing process. GERD symptoms can worsen when garlic water is consumed. Heartburn and sour taste become more pronounced, worsening the overall condition and quality of life. Nighttime bouts of heartburn can become frequent and intense, causing sleep disturbance and general malaise. Studies show that garlic and other spicy foods can worsen GERD symptoms. In a 2010 study, researchers examined the effect of diet on GERD and found that foods with high acidity, including garlic, worsened heartburn and reflux symptoms. Patients who consumed garlic experienced increased heartburn and burning in the esophagus. Thus, it is important for people with GERD to avoid foods that increase symptoms. Garlic water may be too aggressive for sensitive esophagus and stomach. It is recommended to avoid drinking garlic water for GERD and focus on a diet that reduces acidity and minimizes the risk of reflux to reduce symptoms and improve overall health. Number 3. Peptic ulcer disease is a chronic disease in which ulcers form on the mucosa of the stomach and duodenum. The main causes include infection with the bacterium Helicobacter pylori and long-term use of non-steroidal anti-inflammatory drugs. Garlic contains allicin, which has a strong irritant effect. In contact with inflamed mucosa of the stomach and duodenum, garlic can increase inflammation and irritation, leading to increased pain and delayed healing of ulcers. Garlic stimulates the secretion of stomach acid, which is especially dangerous for people with peptic ulcers. Increased acidity promotes further damage to the mucous membrane and deepens ulcers, increasing pain and the risk of complications such as ulcer perforation or bleeding. For ulcer healing, it is important to create an environment where the mucosa can recover, including reducing acidity and minimizing irritants. Garlic, which has an irritant effect, interferes with this process, slowing ulcer healing and increasing the risk of a chronic course of the disease. Studies confirm the negative effects of garlic on the gastric and duodenal mucosa in peptic ulcer disease. In a 2008 study, garlic consumption was shown to increase gastric acid secretion and exacerbate ulcer symptoms such as pain and heartburn. Patients who consumed garlic experienced worsening of ulcers and delayed healing. Thus, it is important for people with peptic ulcers to avoid foods that irritate the mucous membrane and increase gastric acid secretion. Garlic water may be too aggressive for the sensitive gastric and duodenal mucosa. It is recommended to avoid drinking garlic water for canker sores and focus on a diet that promotes ulcer healing and symptom reduction. This will help improve the condition and quality of life by promoting effective mucosal repair. Number 4. If you have irritable bowel syndrome, IBS, you should avoid drinking garlic water because garlic can increase the symptoms of this condition. IBS is characterized by symptoms such as abdominal pain, bloating, constipation or diarrhea, and intestinal discomfort. Garlic consumption can aggravate these manifestations for several reasons. Garlic contains certain types of carbohydrates known as fermentable oligo-di-monosaccharides and polyols, FODMAPs. These substances can be difficult to digest for people with IBS, leading to increased gas and bloating. FODMAPs pass through the small intestine undigested and into the large intestine, where they are fermented by bacteria, causing gas and bloating, which is especially unpleasant for people with IBS. Allicin and other sulfur-containing compounds in garlic have a powerful irritant effect on the mucous membranes of the gastrointestinal tract. This can lead to increased inflammation in the intestines and worsen symptoms such as pain and discomfort. In addition, garlic stimulates the secretion of gastric juice and enzymes, which can cause additional discomfort for people with IBS, as their digestive system is already in a state of hypersensitivity. Thus, despite the numerous health benefits of garlic, people with irritable bowel syndrome are advised to avoid its consumption in order to prevent exacerbation of symptoms and improve the overall health of the digestive system. Number 5. In chronic kidney disease, you should refuse to drink garlic water, because garlic can increase the load on these organs. Kidneys filter the blood, remove wastes and excess fluid, and maintain electrolyte balance. In chronic kidney disease, these functions are impaired and the extra strain can worsen the condition. Garlic contains bioactive compounds, such as allicin, that have powerful antioxidant and anti-inflammatory effects. These compounds can overload the kidneys, especially if their function is impaired. In chronic kidney disease, the kidney's ability to detoxify and filter is reduced, and additional compounds can worsen the condition. Garlic can have a diuretic effect, increasing the volume of urine and requiring the kidneys to do extra work. This can be problematic for people with chronic kidney disease, as their kidneys can no longer handle the full load. Increased urine volume can cause electrolyte imbalance, leading to arrhythmias and muscle spasms. In addition, garlic can affect blood pressure. For patients with chronic kidney disease, controlling blood pressure is difficult, and unpredictable changes can negatively impact renal function and overall health. Studies show that patients with chronic kidney disease should carefully monitor their diet, avoiding foods that can increase the burden on the kidneys. For example, a 2018 study found that certain food components may worsen the condition of patients with chronic kidney disease. Thus, despite the beneficial properties of garlic, people with chronic kidney disease are advised to avoid consuming garlic water to reduce the load on the kidneys and prevent their condition from worsening. Number 6. Consumption of garlic water can be harmful for people with liver problems as garlic increases the load on this important organ. The liver plays a key role in metabolism, detoxification, and protein synthesis. In liver diseases such as cirrhosis, hepatitis, or fatty dystrophy, its functions are impaired and the extra load can worsen the condition. Garlic contains allicin and other active compounds that require metabolic processing in the liver. These substances can enhance detoxification processes, requiring the liver to do extra work. For a weakened liver, this workload can be excessive and harmful. Garlic also stimulates the production of enzymes involved in metabolism. Under normal circumstances, this is beneficial, but in liver disease, activation of enzymatic processes can overload the organ. This is especially dangerous for people with chronic liver disease. In addition, garlic can be hepatotoxic at high doses. Studies show that excessive garlic consumption can cause liver damage. For example, a 2009 study showed that high doses of garlic can increase liver enzymes, indicating tissue damage. The liver also synthesizes glutathione, an important antioxidant. Increased stress on the liver can deplete glutathione stores, reducing the body's ability to fight oxidative stress. For people with liver disease, this is especially important because their ability to synthesize glutathione is already reduced. A 2014 study found that patients with liver disease should avoid foods that increase liver stress, including garlic. It is recommended to consult a doctor before adding garlic to the diet. Thus, people with liver problems are advised to avoid consuming garlic water to reduce the load on the liver and prevent liver deterioration. Number 7. Consumption of garlic water during pregnancy and breastfeeding may be undesirable due to the risk of heartburn and stomach irritation. These conditions can worsen the overall health of the mother and cause discomfort. Pregnancy causes many changes in a woman's body, including hormonal shifts and increased pressure on the stomach due to the growing fetus. This can weaken the lower esophageal sphincter, contributing to frequent bouts of heartburn. Garlic in concentrated form, such as garlic water, can further irritate the gastric and esophageal mucosa, exacerbating heartburn symptoms. Garlic contains active compounds such as allicin, which can increase gastric juice secretion, increasing acidity in the stomach. This can lead to heartburn and irritation of the mucous membranes, causing burning in the chest and throat, and impairing a woman's overall health and quality of life. During breastfeeding, the components of garlic can penetrate the breast milk and change its flavor. This may not be to the infant's liking, which can lead to breast refusal and feeding problems. Heartburn and discomfort in the mother can also affect her ability to feed her baby effectively. Studies show that pregnant women and breastfeeding mothers are more susceptible to developing gastroesophageal reflux disease, GERD, due to increased abdominal pressure and changes in the gastrointestinal tract. In a 2013 study, it was confirmed that the incidence of GERD is significantly higher in pregnant women, and garlic can increase the symptoms of this condition. Thus, to avoid heartburn and stomach irritation, pregnant women and nursing mothers are advised to refrain from drinking garlic water. This will help them to maintain comfort and well-being for themselves and their baby. Number 8. Taking anticoagulants such as warfarin or heparin requires careful monitoring as they affect blood clotting and are used to prevent thrombosis. In this context, drinking garlic water can be dangerous because of garlic's ability to enhance the effects of these drugs. Garlic contains allicin, which has anticoagulant properties. Allicin inhibits platelet aggregation and can thin the blood. Under normal circumstances, this is beneficial for improving blood circulation, but when taking anticoagulants, the additional effect of garlic can lead to excessive blood thinning. Excessive blood thinning increases the risk of spontaneous bleeding, such as nosebleeds, gastrointestinal hemorrhages, and brain hemorrhages. Trauma or surgery in these conditions can pose a serious threat because of the difficulty in controlling bleeding. Research supports these concerns. One study published in the journal Blood Coagulation and Fibrinolysis in 2001 found that the combination of garlic and warfarin significantly increased the International Normalized Ratio, INR, indicating an increased risk of bleeding. Researchers concluded that patients taking anticoagulants should avoid foods high in garlic. Other studies also confirm that garlic may interact with anticoagulants. In a study published in the Journal of Clinical Pharmacology in 1998, garlic was shown to increase the anticoagulant effects of warfarin, leading to increased clotting time and an increased risk of bleeding. Thus, people taking anticoagulants should refrain from drinking garlic water. This will help avoid the dangerous side effects of excessive blood thinning and risk of bleeding. Before making changes to your diet or adding new products, such as garlic water, it is important to consult with your doctor to ensure that your treatment is safe and effective. Number 9. Garlic allergy is an unpleasant and potentially dangerous condition in which the body reacts negatively to the components of garlic. Consumption of garlic water in this case can cause a lot of unpleasant symptoms and even lead to serious consequences. When we talk about garlic allergy, we mean hypersensitivity to the proteins contained in this vegetable, such as alliin lysine lysydrase and alliin lyase. These proteins can cause a violent reaction of the immune system, which perceives them as a threat and begins to actively fight them by releasing histamine. If a person with a garlic allergy drinks garlic water, their body may respond with various allergic symptoms. For example, skin reactions such as itching and hives may occur. The respiratory system can also be affected. Difficulty breathing, wheezing, and runny nose are all possible consequences. Gastrointestinal problems such as nausea, abdominal pain, and diarrhea are also not uncommon. In some cases, swelling of the lips, tongue, and throat can occur, which is especially dangerous as it can make breathing difficult. A 2004 study published in the Journal of Allergy and Clinical Immunology found that garlic can indeed cause serious allergic reactions. The study used skin testing and measurement of IgE antibody levels, which confirmed garlic's allergenic properties. Even if garlic is consumed in the form of garlic water, its proteins are still retained and can cause an allergic reaction. Therefore, people with garlic allergies are strongly advised to avoid consuming this product in any form, including garlic water. This will help prevent allergic reactions and related complications. For those who suffer from garlic allergy, it is important to be careful and carefully check the composition of foods and medicines to avoid unwanted effects. Number 10. If you have hypotension, that is low blood pressure, you should avoid drinking garlic water. Garlic has the property of lowering blood pressure, which can be dangerous for people with already low blood pressure. Hypotension is a condition in which blood pressure falls below normal values. It can cause dizziness, weakness, fatigue, and even fainting. When a person with hypotension drinks garlic water, the compounds in garlic, such as allicin, can further lower blood pressure. Allicin, the main active ingredient in garlic, is known for its vasodilator properties. It helps relax the walls of blood vessels, improving blood flow and lowering blood pressure. This property of garlic makes it beneficial for people with hypertension, but poses a danger for those whose blood pressure is already below normal. A 2013 study published in the journal Phytomedicine found that garlic can indeed significantly lower blood pressure. The study involved people with normal and elevated blood pressure, and all participants experienced a decrease in blood pressure readings after consuming garlic. For people with hypotension, this additional reduction in blood pressure can have serious consequences. Dizziness and weakness can worsen, increasing the risk of falls and injuries. In some cases, a severe drop in blood pressure can cause fainting, which is especially dangerous if a person is on the move or driving. Thus, people with hypotension are advised to avoid drinking garlic water to avoid putting themselves at additional risk. Instead, it is worth consulting a doctor about safe ways to stay healthy and maintain normal blood pressure levels. Number 11. If you have acute gastrointestinal infections, drinking garlic water can worsen your condition. Garlic, despite its many health benefits, can cause irritation and increase inflammation in the gastrointestinal tract. When you suffer from infectious diseases of the stomach and intestines, such as gastroenteritis or infectious colitis, the mucous membrane of the gastrointestinal tract is already in a state of inflammation and irritation. During this period, it is important to choose foods and drinks that will not aggravate the inflammation or cause additional harm. Garlic contains strong chemical compounds such as allicin, which have antibacterial and anti-inflammatory properties. However, these same compounds can be too aggressive for the already damaged mucous membranes of the stomach and intestines. Garlic consumption in such cases can cause burning, pain, and worsening of symptoms. A 2014 study published in the Journal of Food Science and Technology found that garlic can irritate the gastric mucosa and cause dyspeptic symptoms in some people. During an exacerbation of gastrointestinal infections, it is important to avoid foods that may increase inflammation and irritation. In addition, garlic stimulates the production of gastric juice and enzymes, which under normal circumstances is good for digestion. However, in acute infections, this stimulation can lead to additional irritation and pain. Therefore, if you are facing acute gastrointestinal infections, it is best to avoid garlic water. Instead, it is recommended to drink soothing liquids such as warm water with honey or chamomile tea, which will help calm inflammation and support your recovery. It is always a good idea to consult with your doctor to choose the best treatment and health maintenance methods. Number 12. If you have been diagnosed with cholecystitis, drinking garlic water may be undesirable and even harmful. Cholecystitis is an inflammation of the gallbladder, and during this period, it is crucial to avoid foods that can increase inflammation and cause additional pain. Garlic, while having many beneficial properties such as antibacterial and anti-inflammatory properties, can nevertheless cause an exacerbation of cholecystitis symptoms. Allicin and other active compounds found in garlic stimulate bile production and increase gallbladder contractions. Under normal circumstances, this helps digestion, but when the gallbladder is inflamed, this stimulation can cause severe pain and worsen inflammation. A study published in the World Journal of Gastroenterology in 2013 found that spicy foods such as garlic can increase spasms and inflammation in the gallbladder, especially in patients with chronic biliary tract disease. In this condition, the gallbladder is already under strain, and additional stimulation can exacerbate symptoms such as sharp pain, nausea, and vomiting. In addition, garlic can cause an increase in gastric juice production, which can also be undesirable in gallbladder inflammation. Increased secretion can irritate the mucous membrane of the stomach and gallbladder, leading to a worsening of the general condition. During an exacerbation of cholecystitis, it is important to adhere to a diet that minimizes the load on the gallbladder. It is recommended to avoid spicy, fatty, and fried foods. Instead of garlic water, you can drink soothing beverages such as warm herbal tea, which will help reduce inflammation and support the overall condition of the body. If you have cholecystitis, it is better to consult a doctor or a nutritionist for a safe and healthy diet that will help you avoid exacerbations and maintain your health. Instead of garlic water, you can drink soothing beverages such as warm herbal tea, which will help reduce inflammation and support the overall condition of the body. If you have cholecystitis, it is better to consult a doctor or a nutritionist for a safe and healthy diet that will help you avoid exacerbations and maintain your health. Number 13. Anemia is a condition in which the level of red blood cells or hemoglobin in the blood is reduced, resulting in a lack of oxygen in the body. In people with anemia, the gastric mucosa is often weakened and sensitive to irritants. Garlic, which contains allicin, can irritate the stomach, leading to nausea, heartburn, and abdominal pain. This is especially problematic for people with anemia, as they may have difficulty with appetite and digestion. Increased acidity in the stomach due to garlic can interfere with the absorption of iron from food, which reduces the effectiveness of anemia treatment. Studies show that foods that irritate the stomach, such as garlic, can negatively affect anemic patients. Thus, people with anemia are advised to avoid drinking garlic water to prevent stomach irritation and improve nutrient absorption, promoting a faster recovery of health. Number 14. Thrombocytopenia is a condition in which there is a low level of platelets, the cells responsible for clotting blood, in the blood. People with thrombocytopenia are prone to increased bleeding and difficulty stopping bleeding. Garlic contains compounds such as allicin, which have anticoagulant properties, meaning they can thin the blood and prevent it from clotting. When platelet levels are low, this can exacerbate the problem, making the blood even more fluid and increasing the risk of spontaneous bleeding. Regular consumption of garlic water in this situation can lead to serious complications. For example, even a minor injury or cut can cause significant bleeding that will be difficult to stop. Internal bleeding, such as nosebleeds or bleeding in the gastrointestinal tract, can also become more likely and dangerous. Studies confirm that foods with anticoagulant properties, such as garlic, can significantly increase the risk of bleeding in people with thrombocytopenia. Thus, people with thrombocytopenia are advised to refrain from consuming garlic water to avoid worsening the condition and prevent dangerous bleeding. Before changing your diet, it is important to consult your doctor to ensure safety and health. Number 15. Pancreatitis is an inflammation of the pancreas, an organ that plays a key role in digestion and blood sugar regulation. In pancreatitis, the pancreas becomes irritated and inflamed, leading to pain and impaired function. Garlic, despite its many health benefits, can be an irritant to an inflamed pancreas. The active compounds, such as allicin, have a strong flavor and can stimulate pancreatic enzyme production. In conditions of inflammation, this can aggravate the condition by increasing irritation and inflammation of the organ. When the pancreas is already inflamed, the additional enzyme stimulation caused by eating garlic can lead to increased pain and discomfort. This can slow down the recovery process and make treatment less effective. Symptoms of pancreatitis, such as acute abdominal pain, nausea, and vomiting, may become more severe when irritating foods, including garlic, are consumed. During an exacerbation of pancreatitis, it is important to avoid any foods that may increase inflammation and cause additional irritation to the pancreas. Garlic water, despite all its beneficial properties, can be too aggressive for the sensitive organ, leading to a worsening of the condition and delayed recovery. Thus, people with pancreatitis are advised to refrain from drinking garlic water to avoid aggravation of inflammation and facilitate the healing process. A balanced and gentle diet, coordinated with the doctor, will help to maintain the health of the pancreas and promote its recovery. Number 16. If you are taking medications that reduce stomach acidity, such as proton pump inhibitors or antacids, you should refrain from drinking garlic water. Garlic, despite its many health benefits, can reduce the effectiveness of these medications. The active components of garlic, such as allicin, can stimulate the production of gastric juice, which contradicts the action of drugs aimed at reducing acidity. As a result, taking garlic water at the same time with these drugs, you may not get the expected therapeutic effect because garlic neutralizes their effect. Drugs that reduce stomach acidity are used to treat various conditions such as gastritis, peptic ulcer disease, and gastroesophageal reflux disease, GERD. Their goal is to reduce the amount of stomach acid to allow the mucous membranes of the stomach and esophagus to heal, reduce inflammation, and prevent symptoms such as heartburn and pain. Consuming garlic water, which stimulates the production of gastric juice, can worsen the condition by causing an exacerbation of symptoms and slowing down the healing process. Thus, to avoid reducing the effectiveness of the treatment and worsening the stomach condition, it is recommended that you refrain from drinking garlic water while taking medications that reduce stomach acidity. This will help to maximize the benefits of drug therapy and speed up the healing process. Number 17. If you have arrhythmias or other heart rhythm disorders, you should avoid drinking garlic water. Garlic, despite its health benefits, can affect heart function, which is dangerous in arrhythmias. The active ingredients in garlic, such as allicin, can alter the frequency and rhythm of the heartbeat. Arrhythmias are characterized by irregular heart rhythm, which requires careful monitoring. Garlic can interact with medications to treat arrhythmias, enhancing or weakening their effects, which can lead to unpredictable changes in heart function. Studies show that garlic can cause changes in the electrophysiologic parameters of the heart. One 2013 study found that garlic caused changes in heart function in some patients. To avoid risks, people with arrhythmias are advised to refrain from drinking garlic water and consult a doctor to choose safe cardiovascular support methods. Number 18. If you have decompensated diabetes, drinking garlic water may not be safe. Garlic has the ability to affect blood sugar levels, which in unstable diabetes can make the condition worse. In the decompensation stage, blood sugar levels are already difficult to control and any changes can lead to serious consequences. Garlic contains allicin, which can lower blood glucose levels. Under normal circumstances, this is beneficial, but in decompensated diabetes, sudden fluctuations in sugar levels can be dangerous. It is important to keep glucose levels stable to avoid hypoglycemia or hyperglycemia, which can lead to complications such as diabetic coma. In addition, garlic can interact with medications taken to control diabetes, enhancing their effects and causing unwanted effects. For example, if you are taking insulin or other sugar-lowering medications, garlic can enhance their effects, leading to excessive sugar reduction. Studies confirm that garlic can affect glucose metabolism. In a 2006 study, it was shown that garlic can lower blood sugar levels in diabetic patients. However, in decompensated diabetes, such fluctuations can be dangerous and require close monitoring. Therefore, people with decompensated diabetes are advised to avoid drinking garlic water. It is better to consult a doctor to choose safe and effective methods to control blood sugar levels and maintain overall health. Number 19. If you have blood circulation problems, drinking garlic water can cause unwanted complications. Garlic has the property of altering the rheological properties of blood, which can be dangerous for people with circulatory disorders. Garlic, especially in large quantities, can act as a natural anticoagulant. This means that it can thin the blood, reducing its ability to clot. For people with normal blood circulation, this can be beneficial, but if you have circulation problems, these changes can make the condition worse. For example, if you already have thrombosis or a tendency to bleed, eating garlic can increase the risk of serious complications. Thinned blood cannot clot properly, which can lead to internal bleeding or difficulty stopping bleeding from injuries. In addition, garlic can interact with medications prescribed to treat circulatory disorders, enhancing their effects and causing unwanted effects. Studies confirm that garlic can affect blood clotting. In a 2001 study, it was shown that garlic can increase blood clotting time, which is especially dangerous for people with bleeding disorders. Researchers concluded that patients with circulatory problems should avoid foods high in garlic to prevent possible complications. Thus, it is important to avoid consuming garlic water if you have circulatory problems. This will help to avoid potential risks and maintain a stable health condition. It is better to consult your doctor to choose safe and effective methods to treat and support your circulatory system. Number 20. If you have circulatory problems such as hemophilia or other clotting disorders, drinking garlic water can pose a serious threat. Hemophilia is associated with an inadequate ability of the blood to clot, and garlic, which has anticoagulant properties, can worsen this condition. Garlic thins the blood, which can increase the risk of prolonged and uncontrolled bleeding. This is especially dangerous for people with hemophilia, as even small cuts can become a serious problem. In addition, garlic can interact with medications that are taken to improve blood clotting, increasing their effects and creating unpredictable consequences. Research confirms that garlic increases blood clotting time. The journal Blood Coagulation and Fibrinolysis shows that garlic can be dangerous for people with blood clotting disorders, and they should avoid consuming it to prevent the risks. Thus, it is recommended to avoid drinking garlic water if you have circulation problems and clotting disorders. These were the 20 health problems for which you should avoid drinking garlic water. What do you think about it? Do you agree with these statements? If you have any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.